Transition on to our next speaker this morning. Again, real brief intros. So I know some of you actually are probably familiar with Wayne and our next presenter as well. And in fact, he recently, I think in the last week, had a book launched as well. So we're delighted to have Wayne Simmons. He's at the Chief Marketing Office, Global Customer Excellence Group at Pfizer, join us this morning. And he's going to be presenting on obviously a very big picture topic here. Again, plenty of opportunity for questions at the end, but on no more free passes, Pharma's CX imperative. And random fact about Wayne, he was not born in a state or a country. I will leave it there, and he can elaborate further if necessary. Please join me in welcoming Wayne as our next speaker this morning.
Thank you very much, Simon. So I'll be honest with you. I'll answer the riddle in a second here, but nothing scares me more than this clicker. Like, it never works. So AI, advanced technology, digital, this is the showstopper here. So hopefully this works for me. So just a quick little bit of backdrop about me. I am not a pharma person. So I've been in pharma for 3.5 years now, but I come from outside of pharma. And I'm one of those crazy folks that are brought into an industry from outside the industry to change the industry, right? So I'm trying to fight that battle. As you can imagine, it's a very, very interesting day-to-day challenge. So this talk today is about that. No more free passes. So as I got into pharma 3 years ago, it really was clear that CX was becoming a new thing. As all these channels were stood up, the question became, how do we deliver great experiences to our customers? Well, who are our customers? Always the question you get. Is it HCPs, is it patients, all the above? So we really want to try and focus in on how do we help HCPs help patients. That's really the business model that we're in, B to B to C, technically, right? So this idea of the CX imperative and no more free passes comes from this belief that sales and marketing get free passes when it comes to engagement. We can do whatever we want. We send out, campaigns. We execute them. We don't care about the customer. We just, bombard them with stuff. We try and visit them under lunch hours in hospitals. So this idea of free passes is kind of what this overall theme is about. So let me try and advance this here. All right, it works. Thank you. So in my journey into pharma from outside, this picture of Atlas. So if you're not familiar with Greek mythology, Atlas was being punished by Zeus in this picture. And the punishment was to carry the weight of the world on their shoulders. So anyone here actually in CX, hey Joyce, how you doing? Anyone here actually in CX, in a CX title or CX role? Okay, just a few. Marketing and CX kind of coming together. So, but this is really the picture of like humanity's first CX leader, because that's what it feels sometimes. Like in this strange mystery, this strange occurrence, customer centricity, be patient-centric, comes from the CEO and the board. They talk about it all the time, but then they put the weight of the world on the CX folks to make it happen, right? And so we're scrambling around. The technology is one thing. Technology is straightforward, but it's really the soft stuff, the culture, the mindset, the belief, the lack of conviction from the C-suite that we struggle with. So this is a picture that I like to use to represent that. It's like being punished to carry the weight of the world on your shoulders. So welcome to my world. All right, so a little bit about this book and a little bit of context coming from outside, as an outsider. My fundamental value, my only value to my company and to the reason why I'm here is to bring that outside perspective. Like what's going on in financial services, hospitality. So in a few other talks that I've done over the years in pharma, is to bring that point of view to the front. What's going on with the consumer world? How are consumers interacting with companies? What do they expect? The Amazon effect, right? Things are simple, they're seamless, they're consistent. And that's what customers expect, whether they're HCPs or whether they're patients, right? So what I've seen is in pharma, the way CX is kind of positioned, there's a bit of a gap when it comes to commercial and direct to consumer, like consumer-like behaviors, like really, really embracing that idea of delivering consumer-like experiences. a lot of advancement gone on in market research and operations in terms of like hubs, listening to patients, and design, creating journeys, designing journeys. But the commercial and direct consumer piece is what we sensed the gap was, my co-author and I. So what we've done is, and what I've done, is I tried to rebrand traditional customer experience management, because it has sort of a bad negative connotation. And we've rebranded it as customer excellence, for, purely for branding purposes, because it fits into the vernacular that's in marketing in the commercial world, right? So launch excellence, very familiar in here, we talked about it already this morning. Sales excellence, marketing excellence. So customer excellence fits right in there in that conversation. CX, and customer experience management, is a discipline, like this thing that's sort of adjacent to it. So we're trying to integrate this directly into our story. And the end game here is to create value for HCPs and value for the company. That's the dual mission we have. So this book is about that, and I think you'll be hearing more about the book in a minute. So let's take a step back. So Shin and Abby spoke about, back in the day, going to record stores. Remember Tower Records? I love Tower Records. Like, there was stuff all over the place. But there's another crazy thing called going to the movies. Like, you'd go to the cinema and watch a blockbuster movie. So we're going to start there this morning. Does anyone remember this movie? Yeah? Show of hands. Who's seen this movie? All right. We're like having a demographic thing going on here. But this movie, Close Encounters of the Third Kind, not the first kind, not the second kind, but the third kind, is a Steven Spielberg movie. And it's in his top 10 of movies. And he's done great movies, Jaws, Private Ryan, like huge blockbuster movies. But back in the day, this was a great movie, big blockbuster movie. You don't hear much about it these days, but this movie is essentially an alien encounter movie. A guy named Richard Dreyfuss, the actor Richard Dreyfuss, had an encounter on a back road with aliens in a spaceship. And it really left an indelible mark on him. Like, he had this image, it reshaped who he was. And he created this obsession. And so the next day, he comes home, and he starts, first thing in the morning, he's in his garden, he's in his yard, he's throwing all the stuff, vegetation, dirt, mud, into his house, through the kitchen window. All the neighbors are running around, asking, what are you doing? But he's obsessed. He's in his bathrobe, as you can see, and he basically created this image. And the image, as you can see on the lower corner here, lower right, it was an image of a mountain, of what's turned out to be Devil's Tower in Wyoming. So he built this image. This image is burned into his psyche by the aliens. Remember this? The night before, he actually had mashed potatoes. And he was using his fork to create the image. So it became a singular obsession for him. And that became, and as you watch the movie, not quite sure where it's going, but at the end of the day, little spoiler alert here, the spaceship, the aliens, wanted to meet humanity at this mountain. So humanity was converging on this mountain, and they were leaving this imprint to a lot of people. And they were asking them basically to arrive at this mountain to meet them. And that's what ended up happening. But this guy lost it. He lost his stuff and became obsessed with this image of Devil's Tower. Now you're asking, what does that have to do with us, right? Our singular obsession. This is us. I know many of you at home take your mashed potatoes, your fork, and you create the funnel. We have different names for it. It's the marketing funnel, it's the conversion funnel, it's a sales funnel, but it's a funnel. That's our obsession. That's it. We talk to each other through this funnel. We're marketers. We link to sales through this funnel. We have a language, Bofu, tofu, mofu. Only we understand what that means. So when you're at Thanksgiving dinner in a couple of weeks, you're talking about the funnel with your family, talking about bofu and mofu and tofu. They'll have no clue what you're talking about, but we get it. This is our thing. You guys agree? Like, this is where we are. Mm-hmm. So, there's nothing wrong with the funnel. The funnel is awesome for all the reasons I just mentioned. It's a common language. Everyone gets it. It's a common frame of reference, a common way for us to communicate, and you can see how it links to sales. There's tension at that crossing the line thing down at the bottom of the funnel, but it's a way for us to connect. And we tried to solve that marketing sales integration story through the funnel. We've mastered it. We've engineered our technology to support this story. It's all good. And the beauty of the funnel is that it's absolutely super optimized for customer acquisition. That's what it's for, finding customers, turning a visit into a conversion at the bottom. And that's what we do. We try and perfect that. This is our factory. We try and optimize it. We try and gain efficiencies out of it, trying to get scale out of it, but this is the way we do it. So, what's changed? Why am I really here? You know about the funnel better than I do. So, this is really a point of view. Maybe you agree with it, maybe you don't. But coming from outside of pharma, something fundamental has happened, something's changed when it comes to our commercial thinking. We know that customers and consumers have the Amazon effect going on, where they have heightened expectations for how companies should interact with them. Higher level of service, convenience, simplicity, et cetera. We know that. But commercially, what does that mean for us? So our thesis is pretty simple. Up until this point, we've all competed. We're all competitors. We're battling out in the trenches right now. And we compete on product factors and brand factors. So we're mixing it up in that regard. Our product's better than yours. My brand's better than yours. Reputation of our company is better than yours, right? That's how we're competing. So we're sitting in front of our customers with that kind of conversation. Our content supports that dialogue as well. So we're reinforcing it with content, trying to drive our product benefits and our brand benefits. Nothing wrong with that. Super optimized for customer acquisition. But what's happened is, and I'm not sure when it happened, we can all say within pharma it happened that sort of post-COVID, but experiential factors now play a role, actually a significant role, in the buying decision. So if I'm an HCP, I'm deciding not only on product factors, critically important, safety, efficacy, got to be in the game product-wise. Brand, company reputation, trust. If you're not trusted, forget it. Nothing matters. Critically important. But now, how easy is it to get to your medicines? How simple? How hard is it for patients to stay on it? So these experiential factors now play a significant role. So if we're all marketing and using our funnel to market to product and brand, and we're leaving this massive hole, so I call this like a power of 3. If you're doing a power of 2, are you going to win? So that's the big change that's happened. So yeah, consumers, heightened expectations to deliver great experiences, no question about that. We're all consumers. But commercially, what does it mean? It means we've got to start winning and competing in that space. Okay? So why does this really matter? This is the slide you're not going to like me about. I'm going to be escorted out of here. But the fact of the matter is, and Shin and Abby talked about this, in the first discussion, talking about insights and understanding customers and their needs. So when I got into pharma, the first question I asked in the first series of activities that I did is like, who is the customer and what are they grappling with? What's their struggle? And how can I make their lives better? So I came across these stats around burnout. Like you've all seen them. These are from AMA. It's a massive deal. So I saw that. I was like, oh, okay, that's simple. How can we help solve the burnout problem? It's not last mile delivery. It's not like having hotel rooms that are clean and available, but it's burnout. How do we solve for that? And so kept on digging into it. Obviously, this burnout issue was worse during COVID. It was bad before, and it's kind of come down a little bit, but it's still pretty elevated. Now think about this. Our customers are basically saying, we don't want to be your customers anymore. We want to get out of this business. I'm going to go to school for 15 years, and I want out. Because this whole industry is killing me. So when you talk about what HCPs are thinking about, my mind goes to, as from outside of pharma, is like, okay, they're thinking about burnout. They're inflamed. On the other side of the ball, what are we thinking about? So when I first got to pharma, I heard this statement over and over again. The right message, the right person at the right time. That's our mantra. It's on the walls, we have posters. Everything we're doing is engineered around that solution. Now think about this. And I could be wrong. This is my assessment of like what HCPs are thinking about. Think of the disconnect there. So go back to this idea of experiential factors playing a significant role in buying decisions and prescribing decisions, preference, and think about this disconnect. And the question then becomes, are we adding to this burnout, or are we helping them with the burnout? Is this campaign we're doing going to help them? Is this bit of knowledge going to help them? Or is it going to help us with our agenda? So these are the questions that are hard questions, but I think as an industry, we have to ask. Because if you believe in the burnout issue, or if we just put it off to the side, don't worry about that. Let's hammer this campaign out. Let's launch this new brand. Let's hold this new Congress. Let's hammer them, you know? And another thing that I discovered in pharma when I first got here was there's a belief that we're the only ones talking to the HCP. Like it's only us. They're waiting for our content. They're sitting in their, you know, the doctor's lounge waiting for our content to come in at 10 o'clock on a Tuesday. But the reality is we're all doing it, right? We're all hammering. So collectively, are we adding to this burnout, right? Is again the question that we have to ask as an industry. And we think that our sales reps, our field reps are the only ones in the hallways waiting to visit doctors. No, we're all doing it. So it's a problem at scale, global scale. We're all doing it right now while we're in this room. So this creates an urgent need, to focus on experiential factors, making life easy, simple, taking down the burden for HCPs and care teams, their offices, their office staff, and empathy. So this is empathy in a very tangible way. Empathy can be sort of this abstract concept, but empathy, this is what it looks like. Understanding and addressing their pain, and using that as a lens to conduct commercial activities. Are we adding to burnout? Are we not? Fundamental question. Okay, again, my personal point of view. All right, now, here's the fun part. Going from the abstract of empathy and experience, all these funny words, to a pragmatic look at the world. What do we do about it as commercial folk? How do we address this issue? And what I propose is not that complicated. We get out of the funnel mind frame that we're in, that obsession that we have with the funnel, healthy obsession, I hope, and we go to what I call the bow tie. So super optimized for acquisition in the funnel, going to the bow tie, optimized for acquisition and retention. Phase 1. Phase 2, acquisition, retention, expansion. That's called the flywheel. That's the road to empathy and the experiential factors. Changing that singular obsession into a different obsession, hopefully. The reason that the flywheel outcome is what we're shooting for is because these frameworks are the fundamental, elemental components of our commercial models, our go-to-market models. So if you change it from the funnel to the bow tie, that means you're focusing on retaining the customers. So acquiring them is one thing. Investing to acquire, launch, but how do you retain customers? And it's a foreign word in pharma, retention. How do we keep them? Keep them happy, keep them engaged, keep them coming back for more. The same principles apply in pharma as it does outside. So retaining them. And then expansion. Just because I'm retained doesn't mean I'm expanding my portfolio with you, my share of wallet with you, my share of mind with you. But the key here is the left side of the equation, right? Left side. The acquisition piece is marketing and sales driven. That's where we play, around the funnel. We have a funnel in our office, we're worshiping that funnel. The other side of the ball, retention and expansion, that's about experience. And that's where the opportunity is, that's where the gap is, and that's the change that we have to make. So I'm thinking, okay, the Pharma CX Summit, that's what we're going to talk about. How do we deliver experiences? And the thesis here is, the point of view, is that in order to do that, you have to adopt a totally different commercial model. And this is the model that I'm suggesting, as a point of view. Funnel, bow tie, flywheel. So with that, I'm gonna close it out early to answer any questions, take any heat from outside. But remember, I come here in peace from outside of Pharma. So, thank you.
Thank you, Wayne. That was a great talk. We've got a couple of minutes before we move on to our next talk for any questions. Anybody want to chime in with comments? Yeah, Mark. Excuse me. Sorry, just navigating across here.
So this industry loves data,
Yeah.
and there seems to be a dearth of data in the CX space. You're outside of industry, you go to every other industry outside of this industry, and we've got dashboards, the C-suite relies on that. We hear terms like NPS, like it's how we talk about customers. What is the data that makes this flywheel happen? Are
Yeah.
we soliciting feedback? How do we get it? How do we use it?
Yeah, great question. In Pharma and outside of Pharma, there's no shortage of data. We're generating petabytes of data, daily, weekly. So the data isn't the problem, I don't think, in a sort of pure sense. The question that I grapple with is, what do you do with that data? Like, how can you action it? If someone says, here's what our customers are saying, are we taking action on it? And that becomes a cultural thing. So I think the companies that are excellent at experience, they have cultures that covet customer feedback and they take action on it. It's Jeff Bezos, it's Horst Schulze at Ritz-Carlton, it's Herb Kelleher at Southwest. They, at the senior level, they have conviction about the customer and the feedback and how it's valuable, how it's precious, and it drives their entire business. That doesn't exist in Pharma. So we have the muscle of building up data, like massive amounts of data. We're trying to generate insights out of it. AI is going to give us answers from those insights, but we act on it, particularly when it doesn't say what you want to say. When it says, hey, stop hitting me with emails, what are we going to do? We don't want to hear that. So I believe that the soft factors, the culture, the mindset, the beliefs, the leadership, conviction, and intent are the barriers. So the data is not the problem. We can collect data, we buy it, we sort it, we do all kinds of fun things with it, spend a ton of money on it. There's no shortage of it. But the shortage are the soft factors. Hopefully I answered your question. Joy.
Hi, Wayne. Thank you for explaining the challenge in a simplistic way with a few pictures that makes it easy for us to understand. Not necessarily easy to act on, but easy to understand. If you look at the flywheel and you look at the bow tie, and that's HCP-centric,
Yeah.
if you put a more patient-centric lens on it and go even further sort of up the funnel, if I may use that analogy, and you're thinking about advocacy and clinical trials and truly like the patient,
Yeah.
how does the expansion change? Is it more focused around brand loyalty, adoption? Can you talk to that?
Sure. So I'm going to say something very provocative, and again, you may not like me after this, and these are definitely my personal beliefs, not my company's. I believe that we are extraordinarily patient-centric as an industry already. We engage with patients, understand them down to the molecular level about what their issues are and challenges are, and we build clinical solutions to solve them. So we are engaged with that patient. The gap is the healthcare professional. And so I believe that our job is to help healthcare professionals help patients. That's the continuum that I think is broken. We're selling to those HCPs. We're not helping them do anything. So I may not be addressing your question directly, Joyce, but I believe that that flywheel, that expansion, that engagement with HCPs, built around helping them help patients, that's the magic. That's what no one's going to call, Pfizer. They're going to call their doc. So how do we help them help patients? And just bear with me, I'm going to try and be simple again, and I'm not trying to oversimplify things. This is very similar to what happened in the automotive industry over the last 20 years. So if you don't know, and actually hospitality as well, but the major brands, so GM, Ford, Mercedes, BMW, they don't own their dealerships. They're owned by private, companies, private business folks that own portfolios of dealerships. And years ago, those dealerships were independently named. They were sort of like whatever, they had a license to sell the product, but they were just, John Smith's BMW dealership. Now, because of this sort of model, B2B2C model, they have branded themselves. There's a consistent model at the dealerships. So regardless of who owns it, they all look like BMW dealerships. They're all consistent and defined. Because the car manufacturers, OEMs, we're OEMs, have enabled those dealers to better help their end customer. They've given better service technology, they've given better information to service them, and everybody wins. The manufacturer gets service fees, the dealerships get service fees, and the customer gets things they need to solve their problems. So that's the model, the mantra, like helping HCPs help patients. So.
Are you getting the anticipated pushback, or are you slowly feel like you're converting folks either at Pfizer or across the industry as you evangelize?
I'm certainly trying to, be an evangelist about it. Am I getting pushback? Sure, but also converts as well. So there's pockets of yes, let's go do that. And the commercial model, the flywheel, is something that people understand and are trying to get to. How can we do that? What does it take to be experience-driven in that other half of the commercial wheel? So a lot of resistance, of course, not malice, just sort of like that's not how we do things at Pharma. But there are lots of pockets as well of progress.
Let's give Wayne a round of applause. Thank you for your question.
Sorry. Thank you.